And let me once again officially welcome everybody to today's online event, Sexual Violence, an International Perspective. This event is part of a series on sexual violence, and it's sponsored by the National Institute of Justice and the Government Innovators Network. Before turning things over to the moderator, I'd just like to begin today with a pair of polling questions, and this will give all of you and our panel a better idea of who exactly is in our audience today. So if you wouldn't mind, please just click on the option in front of you that is most suitable. And so far it's looking like we have a majority of victim advocates, but also some folks in law enforcement, some researchers, a few policymakers. I'll just leave that up for another few seconds, and we have one more poll after this. All right, thanks so much. As you can see, we have a pretty broad professional spread, and we have one more poll here about your area of interest. And we do only have the ability to select one option here, so please just pick the area of greatest interest. And I'll leave this up for another few seconds for everyone a chance to pick their option. All right, well, thank you everybody for your participation, and without any further ado, I would like to pass things over to today's moderator, Kristina Rose, who is the Senior Advisor to the Director of the National Institute of Justice at the Department of Justice. Ms. Rose.
Thank you so much, Jim. Welcome, everyone, to our web chat today. I'm honored to be moderating this panel, and on behalf of NIJ and the Government Innovators Network, I want to thank all of you for your participation. And I'd like to give a special thanks to Jim Cooney and to Melissa Marmer, who have done all the coordination on this event, so thanks to both of you. As Jim mentioned, I'm Chris Rose, and I'm the Senior Advisor to the Director at NIJ. And for those of you not familiar with NIJ, NIJ is the Research, Development, and Evaluation arm of the Justice Department. We have a very impressive panel with us today, and I'd like to take the opportunity to introduce each one of them to you now. First, we have the Honorable Cindy Dyer, who is the Director of the Office on Violence Against Women at the Department of Justice. Cindy was appointed by President Bush and confirmed by the U.S. Senate as Director last December. Cindy recently served as the Violence Against Women expert at the UN Crime Commission meeting this past April, where she worked on a UN resolution on violence against women. Cindy, who's a native Texan, is currently based in Washington, D.C. And next we have Gary Sheridan. Gary is the program manager for the International Criminal Investigative Training Assistance Program, which fortunately has an acronym that is otherwise known as ISATAP. And it is also located in the Justice Department. Today, Gary's going to discuss efforts in Colombia to redesign the investigative process for sexual violence cases, especially the collection and the preservation of physical evidence. And Gary is currently based in Bogota, Colombia, and he's calling us from Bogota. And then third, we have Dr. Rachel Jewkes, who is the Director of the Medical Research Council's Gender and Health Research Unit, and they're based in Pretoria, South Africa. Dr. Jewkes has spent more than a decade researching gender-based violence, particularly intimate partner violence and sexual violence in South Africa, and she used methods drawn from anthropology, epidemiology, and health systems research. Our three panelists today all bring very unique perspectives on sexual violence, and we have policy covered, we have research covered, and practice. They'll all be represented here today. And each of our panelists in different ways. They're really all working to change the culture around sexual violence. You know, whether it's through training police and prosecutors to improve their investigations, whether it's developing strategies to build effective health service responses to sexual assault, or creating grant programs that respond to the needs of sexual assault victims. Each one of these panelists is doing very important and valuable work to end sexual violence around the world. I'd like to begin by asking each of our panelists to give a brief overview of their work, and then we can get started with responding to your questions. Cindy, why don't we start with you?
Okay, thank you so much. As Chris said, I'm currently the director of the Office on Violence Against Women here at the United States Department of Justice, but prior to coming here, I was a specialized domestic violence and sexual assault prosecutor in Dallas, Texas for 14 years. Since coming to the Office on Violence Against Women, I've had an opportunity to participate in 3 different events recently that I wanted to briefly highlight. The first one that I wanted to mention is the United Nations Commission on Crime Prevention and Criminal Justice. The Crime Commission had their last meeting in Vienna from April the 14th to the 18th, and there were over 35 countries that were in attendance. During this particular commission, there was a thematic debate held regarding violence against women and girls. And I was fortunate to attend as part of the United States delegation. There was a resolution that was discussed regarding violence against women and girls, but it ended up being very contentious, and a consensus was not reached on that resolution. We were, however, able to negotiate a draft decision which condemned all forms of violence against women. This draft decision requests the United Nations Office of Drugs and Crime to convene an experts meeting to review and update the document, the UN Model Strategies and Practical Measures on the Elimination of Violence Against Women, which has not been updated in over 10 years. And so that was one really good result of that meeting. Additionally, during the Crime Commission, the Department of Justice and the National Institute of Justice sponsored a side event which showcases a new virtual training tool. This particular training tool is for training healthcare professionals on how to perform medical forensic examinations that minimize trauma to victims. This particular side event, which Chris Rose masterfully hosted, was very well attended by countries from all over the world and was a really exciting addition to that UN meeting. The second event that I wanted to highlight, I was recently able to attend the United Nations Security Council meeting in New York that was held this past summer. Secretary Rice chaired a thematic debate to discuss Resolution 1820. The purpose was to address sexual violence against women in conflict and post-conflict areas. And it was very important because this resolution, which was adopted, recognizes for the first time that sexual violence is now being used as a military tactic and a tool of warfare. And because sexual violence can be used not just as a crime of opportunity in an area that is war-torn, but actually as a military tactic, it is in fact a proper discussion to be had at the UN Security Council. Specifically, according to Amnesty International, 1 out of every 3 women in the world has been beaten, coerced into sex, or otherwise abused in her lifetime. Specifically in the United States, a woman is raped every 6 minutes. In global conflicts and wars, rape is widespread and it is a tool of war, and that was a quote from Secretary of State Condoleezza Rice. The third event that I had the opportunity to attend was the International Family Justice Center Conference, which was held right outside London, England, in Croydon. It was hosted by the Croydon Family Justice Center. This particular center in Croydon is modeled after the Family Justice Centers in the United States that were developed several years ago under the President's Family Justice Center Initiative. The purpose, for those of you who do not know, of a Family Justice Center is specifically to embody a strong, coordinated community response by bringing together under one roof victims advocates, law enforcement officers, probation, prosecution, forensic medical professionals, legal attorneys, and representatives from NGOs that will best serve victims of sexual assault and domestic violence. Specifically, the Croydon Family Justice Center, which is, as I mentioned, is right outside of London. It opened its doors in 2005, and it is the first Family Justice Center in Europe. Specific things that we talked about at this conference were how sexual assault is being used in the United States as a new tool for gangs. Many gangs, instead of running drugs, are beginning to operate prostitution and sexual violence rings. Additionally, sexual violence is occurring obviously in the UK, and it is truly an international epidemic. And there are specific problems, especially in the UK, regarding trafficking and honor-based killings. So those are highlights of three things that we've had an opportunity to participate in, and I look forward to answering any questions that you might have and discussing ways that we can collaborate with both domestic and foreign partners.
Thank you so much, Cindy. Now I'd like to ask Gary to talk a little bit about the work he's doing.
Yes, good morning, good afternoon, and good evening to everyone, depending on what part of the world you might be in. Quite an honor for me and members of my office to participate in this event, and I want to thank all the organizers who put the event together, and I want to thank all the audience members who I know will be participating later in a very interactive question and answer. But as it's been mentioned, my name is Gary Sheridan, and I'm the Department of Justice DCCAP Program Manager in Bogota, Colombia, and I've lived and worked in Colombia for about 11 years total, the last 5 years in this current position. The Department of Justice has a broad variety of programs in Colombia and other countries, and not only are some of those programs designed toward the traditional law enforcement activities that you probably all think of when you think of the FBI and the Drug Enforcement Administration and ATF and others, but there's also a technical assistance and development component, and that's what my program does on the ground on a daily basis here. It was determined back in around 2005 that under our broader human rights initiative that we needed to take a strong and hard look at the issue of sexual assault and the what turned out to really be the lack of competent and effective investigation in that field. We started off by holding a very broad diagnostic working group meeting in which we brought in a lot of experts from the local government agencies here, not only police and prosecutors and judges, but also those who work in family services, social services, health department, community activity offices. And after several days of meetings, we developed a five-pillared integrated strategy to confront the program. And those of you who are at computers can see that that included new developments in protocol and legislative changes, training and technical assistance program, enhancing the use of DNA and forensic sciences in the investigation of sexual crimes and sexual assaults, some equipment donations, investigative equipment, and also a public awareness program that we felt was very necessary to carry the word of what we were doing out to the community. real quickly, I'll just run through briefly what those 5 pillars contain. The first one, again, being the legislative changes. A lot of that we're working with key members of Congress who we've made contacts with here and who are supporting our program. But also, a lot of that is just police standard operating procedures and protocols, especially in the area of crime scene response to the victim, and evidence collection. It's very much lacking. Crime scenes rarely were visited. The reports were getting in the hands of detectives way too late. By then, really, a crime scene didn't exist. Too much time had passed from the initial reporting to the first opportunity to respond to a crime scene. So we did a lot just to modify those standard police SOPs, requiring the police now to arrive at a crime scene and do a proper crime scene analysis and processing, right from the beginning. We developed a broad-based technical and training assistance program, not only in areas of investigation such as crime scene, evidence management, clinical examinations, and so forth, but also in topics that you might not think of are important, but they are important to investigators in areas such as human sexuality and anatomy. This is a specialized crime. There's specialized vocabulary. There's specialized clinical examinations that take place. And it's an intimate crime of violence, but the investigators got to be comfortable, armed, and aware of how to phrase questions when doing interviews, and how to respond to the answers that victims and witnesses may give them. Colombia's always had DNA examination in CODIS database here. It probably is not being used to the greatest extent and the greatest levels of effectiveness. So we've tried to enhance that. We bought a lot of reagent chemicals. We're trying to develop some interagency agreements between laboratories so that sexual assault DNA exams are conducted more rapidly and on a timely basis. As I mentioned, we donate a lot of investigative equipment. Not going to really talk about that. It's all the standard type things that you would expect would be needed in a sexual assault investigation. And lastly, the final pillar, which is the public awareness. And again, we're trying to get the word out to the public that you should report these crimes, that the police are being better prepared, that there is a good chance that competent investigation will be handled, will take place. We have had several news story type opportunities, either taping and filming some of our training sessions and getting that broadcast by local news television programs. Also, we've done several bulletins involving some of our activities through the use of the embassy press office, but we've had a good amount of luck and a good amount of outreach in that area also. So with that, I'll wrap up and pass on to Rachel, but I'll be here and available for the next hour and a half to receive questions and hopefully give you good, sound answers. Thank you.
Thank you so much, Gary. Rachel?
Right, thank you. I have been undertaking research on sexual violence in South Africa for about 15 years. And the main focus of our work at the Medical Research Council has been trying to basically sort of fill out the picture of trying to understand what's happening in terms of sexual and gender-based violence in South Africa, and then looking to use research to try and inform the development and evaluation of interventions. And so we've done a number of studies that have investigated the prevalence of sexual violence in different populations and risk factors, both for rape perpetration as well as victimization. And in particular, we have done research with community-based samples of both men and women. We also are very concerned to particularly understand the social and cultural context of rape in South Africa, and we've undertaken research using ethnographic methods looking at rape of children, as well as looking at rape of adult women and of men, and investigating rape perpetration using these methods. We've tried to investigate intersections between sexual violence and a range of different health outcomes, in particular teenage pregnancy, and shown that forced first sex is particularly important as a risk factor for early teenage pregnancy, looking at the relationships with mental health, and most recently trying to understand the intersections between sexual violence and HIV. We have done research looking at rape cases reported to the police and trying to understand the circumstances in which the type of rape that gets reported to the police occur, looking at what happens to cases within the criminal justice system, in particular attrition of cases, and looking at the relationship between medical legal findings and legal case outcomes. And in particular, we've been trying to ask the question, is what is it when cases are investigated and doctors and nurses play their role in terms of documentation of findings during examination and collecting of specimens that may be tested for DNA and so forth. What is it that seems to be important in terms of contributing towards particular types of case outcomes, whether somebody gets arrested or trials commence, or whether there's actually a conviction at the end of the day. And this research has been very important. We've been looking at interventions to prevent sexual and intimate partner violence and evaluating interventions with youth in rural communities, and more recently trying to develop interventions dating violence for schools. And we've also been looking at the whole area of post-exposure prophylaxis to prevent HIV infection during rape, which obviously, because we have a very high prevalence of rape and a very high prevalence of HIV in South Africa, is a major concern. And we've been looking at issues related to compliance, the question of the cost-effectiveness of providing this, and trying to evaluate interventions to support the completion of courses of drugs given to victims after rape to try and prevent HIV. One of the things we've been trying to do is to make sure that the work we do in South Africa is very relevant towards developing the health sector response. And we've been working with other organisations and a range of other partners in partnership with the National Department of Health since 2001. And we have been doing, firstly using our research to try and raise awareness of the issue and advocate for the need for resources and for attention to the problem of sexual violence in South Africa. We've been looking at what health services look like. We did a situation analysis of the health services. And we did research on what women want and what they value most from health services after rape, which we've used to inform thinking around what are the most appropriate models of care and the best ways of providing high quality care in a country which is very diverse and includes sort of highly urban areas and also sort of deep rural areas like South Africa. We used all that to feed into a collaborative and consultative process of drafting a new national policy and clinical management guidelines with the National Department of Health that have been adopted by the National Department. And over the last couple of years, we've developed a national training curriculum on sexual assault care for training doctors and nurses who provide care to victims within the health services. And this course is a 10-day course which is aimed to equip practitioners with the ability to respond to the health and social needs of victims, as well as a collection of medical legal evidence. It's an evidence-based course, and we've trained the first 150 staff and have evaluated it. Another very important aspect of our work here in South Africa has been that we are the host of the Sexual Violence Research Initiative. We call it the SVRI, and the Sexual Violence Research Initiative was established as an initiative of the Global Forum for Health Research and launched in 2003. And initially the SVRI Secretariat was hosted by the World Health Organization, but in 2006 the Secretariat moved to the Gender and Health Research Unit at our office in Pretoria, and we've been hosting it thereafter. The SVRI aims to promote research on sexual violence and generate empirical data to ensure sexual violence is recognized as a priority health problem. And it is a global initiative, and it has a a coordinating group of 10 international researchers from different global regions who coordinate the work of the SVRI and guide the work of us as the Secretariat. And the SVRI has a number of different aspects to its work, one of which is generating resources. And I think one of our key tools is a sexual violence research agenda, which has tried to set the agenda for research across sexual violence, highlighting the most important issues to be addressed in sexual violence research across the globe. And this is available translated into a range of different languages on our website. We've also commissioned some particular pieces of work and so far have 3 desk reviews. One is on the uses and impacts of medical legal evidence in sexual assault cases. We have a review of women victims' perceptions and responses to rape. And we've produced a review on sexual violence against women and children in China. And we hope that this latter review is going to be the first in a series of overviews of sexual violence in different global regions, and we hope that next year we'll come out with our next one, which is going to be looking at a review of sexual violence research and responses in Latin America. We're planning a series of these. And all of these documents are available on our website, which is one of our key tools. And I really hope that everybody's had a look at the website. But the website is really a central resource for both members of the SVRI and anyone else who wants to visit it. And it has a number of really useful pages. I mean, our reviews of some of the documents are up there. There are also other things there, including issue pages. We've got a number of different issues on aspects of sexual violence that have a dedicated page, and then we've got key resources related to those issues posted on the website that can be accessed. We have a research tools page, and we have tools for measuring sexual violence, tools for doing a situation analysis of sexual violence. We have ethics tools. So the variety of different tools are available on the page, and I think that, again, this is a very heavily visited page by people going into our website who are using it as a resource in their research. We also have...
Hi, this is Jim Cooney. Just to let you know, I'm going to pop up the website you're talking about for a few seconds just so people can see it.
Okay. We've also got country pages. We've got 109 country pages at the moment, and if anyone has a country that they have been involved in doing research in and they don't see it as being as one of our country pages, then we very much like to be contacted and told about your research so that we can link in and get new countries. But here, this is Jim's put up the main SVRI website, and you can see on the left-hand column the country pages and the links and the events calendar, and we have a discussion forum. Here are some of our country pages. You can click on a country and find out what's available. And then scroll down. And scroll down, and then you can see the different reports and documents that we've got that are either up here or are linked through the website. And we're very happy. If anyone's done research anywhere in the world and they want to have a link between their sexual violence research and our website, we're very, very keen to know about it so that we can put it up here, because we see it as really as a key tool for helping keep particularly reports and other things which can become harder to access, sort of available for people who are doing work in different countries. And our email address is csvri@mrc.ac.za, so if anyone wants to contact us, they can email us. And our website is at svri.org, and so it's very easy for people to be able to remember. So we have a range of different activities here. We also have a discussion forum and the SVRI listserv, and anyone who wants to is invited to join our listserv. And then you get 2 mailings a week. One is on what's new in SVRI, on sexual violence, new publications, new calls for people to submit proposals for funding and so forth, events. And we also have a roundup of sexual violence in the news, and that's a global roundup that is sent out every week. And we've had a lot of very positive feedback, particularly from people working as advocates working with victims, on how valuable that is from a lot of different countries. Particularly from low and middle income countries. We are holding our first conference next year in the beginning of July, and we very much hope that people will want to come and attend our conference. They'll want to come and present, come and get involved in the debates and skills building activities and other things that are going to be held as part of this first conference. We're calling it the Sexual Violence Forum 2009. And again, more details will be going up on our website about the conference. So I very much welcome questions, both on the work we're doing in South Africa and sexual violence in South Africa, as well as anything to do with the Sexual Violence Research Initiative.
Thank you very much, Rachel. We've gotten several questions, and I would like to actually direct the first question to Cindy. As you were speaking about the Crime Commission meeting in Vienna, a member of the audience was asking what the primary point of contention was on the Violence Against Women resolution.
Yes, there was a lot of contention regarding the resolution. Much of it, one of the biggest contentions was that the resolution was titled Violence Against Women and Girls, and there was a group of delegates from different countries that didn't want it to be violence against women and girls. They wanted it to be called gender-based violence. And so that was one area of contention. There was a group that said, no, we know these crimes are more likely to be targeted against women and girls. And there was a group that said, yes, but even saying that is somehow feeding into this problem, and therefore it should be gender-based violence. The other issue that was brought up as a big point of contention was because this particular UN is the Crime Commission, and therefore their charge is to deal with things that are crimes and that can be used to prevent crimes and what the response to the crime is. There was a group of the delegates that wanted to focus very narrowly on crime prevention tools, and they wanted a narrow definition of what is a crime prevention tool. Whereas another group of the delegates wanted to focus on things like access to housing, access to a good paying job, access to civil legal assistance, and wanted to classify those things as crime prevention tools because they would allow a victim of domestic violence or sexual assault to leave that situation and therefore not be re-victimized. And so there was a very much of a disagreement about that. The final disagreement, which may have been maybe the most pronounced, was more perhaps what you would expect, where some of the countries, in my opinion, in my view, just were not ready to really tackle the issue of violence against women because it, by definition, required us to look at and talk about women's inequality. And for countries that still have sort of mandated either by legislation or by religious values or other things, sort of a real problem with women's inequality, they were not ready to say, well, one way to address violence against women is to address the underlying inequality. And that probably was the biggest disagreement.
Thank you, Cindy.
Thank you for the question. It was very interesting, and I love visiting about it.
Another audience member has inquired, and this could really be for any of the panelists, wanted somebody to speak a little bit more on honor killings. Is there anyone on the panel that would like to address that? Dr. Jewkes, have you done research on that?
Well, actually, we don't really have honor killings in South Africa. So, or we may do, but it would be very, very small numbers. We have a huge problem of intimate femicide, and we did a national study and showed that we had the highest rate of murder of wives and girlfriends of any country in the world. I think the rate was about 8. It was over 8 per 100,000 women per year. That was several times higher than the rate in the United States, for example. But we wouldn't frame them as honor killings.
Okay.
I think I may have mentioned the term, this is Cindy, honor killings during my presentation. I was particularly I had the opportunity to discuss this issue when I was in the UK. We were visiting with people from all over the country, all over the world. We're visiting with the local law enforcement officers in the UK. They were talking about it in terms of a new phenomena because so many of the immigrants into the London area, into the UK, are from countries where there has been a history of utilizing and using honor killings. The UK is suddenly having this issue come up when historically they did not. And they attributed it in large part to huge number of immigrants from countries where this is going on. And they were discussing it as a huge problem for the UK, and that there were areas that really had a very high number of honor killings, and a lot of it was in fact related to the forced marriage issue. In fact, one of the most interesting things was the Croydon Family Justice Center, which was historically set up as a domestic violence and sexual assault response agency. It's located in the borough of Croydon, and it's actually near like a community college and other schools. And they actually have a program where girls who live in that neighborhood, if they begin to hear their family members speak of perhaps a trip to home to wherever they're from, Afghanistan or wherever, over the summer, and they begin to fear that they are going to be forced into a marriage, they can actually go register at the Croydon Family Justice Center. And they say, if I don't come back at the end of the summer, come get me. And they have actually rescued several girls who have registered themselves at the Croydon Family Justice Center. And I thought that was what a marvelous response to a cause and to a crime that they had not seen before.
Thank you, Cindy. Gary, I have a question here that is directed to you. It says, did you meet much resistance from law enforcement and policymakers? And if you did, in bringing on this kind of sexual assault elite unit, the investigative unit, how did you handle that?
Well, Chris, no, we didn't receive resistance to the idea. It was a recognized problem across the board at many levels. And one of the ways, probably in any country, that you're going to want to try and overcome the slight resistance that you might find is to make sure that all the appropriate counterpart agencies and entities from that country are involved in your project right from the beginning. You have to always get a certain amount of buy-in, and of course you're always going to have some people who are going to question an outsider, such as the government of the United States or the Department of Justice, trying to exert influence within their own host countries. Now, as I said, back in 2005, we invited a broad spectrum of early participants to participate in the original diagnostic working group meetings that took place over several days initially, and then continued on over time in smaller working groups until we came up with the the 5-pillar strategy that I've shown previously. As it's mentioned in the slide involving the training and technical assistance, one of the things that we were able to register well with Colombians here was the development of the elite group of special investigators known as Geddes here within the police detective agencies within Bogota. And that was welcomed with open arms, especially at the investigator level. We did have to do a lot of explanation to upper management personnel and to unit supervisors and types who were not completely aware of what we were trying to do. But the Geddes concept was needed. It was well received. The investigators had then and have now a lot of pride in their work they're doing. They're doing better work, although there's a long way to go. But I would say whenever you're going to try and develop a program in a foreign country, you've got to get buy-in from that host country, and the best way to do that is to make sure that the host country officials are involved right from the very start, and they feel like it's part of the project. They're part of the project. We're not just trying to come on in and tell them, look, this is how we do it in the United States, so you should do it this way too. That probably will never work.
Yeah, I think that's a very good point, Gary. A question came in as to where in Colombia have these units been created?
Right now we're testing the protocols and the development in Bogota only. Colombia is a country of about 43 million people. Bogota, the largest city and the capital, is around 8 million people. So if we can get it to work in Bogota, the largest city, I don't have any doubt we'll be able to make it workable and useful in all the other cities. But up until this point, it's been a Bogota project only.
Okay, thanks. Got a couple more questions here. We have one audience member who, and Cindy, you may be able to respond to this. She's asking if there are any programs in the United States to help Asian Indian women who are living here that may have been victims of sexual violence.
Our office is fortunate to have a number of grant programs. And I know that there is a woman named Chick Dobby, and she's actually based in the California area, I think. And it is the Asian Pacific Islander Institute. That is the name of her organization. It's the Asian Pacific Islander Institute. And the particular woman that I have worked with before, her name is Chick, C-H-I-C, Dobby, D-A-B-B-Y, and it is, I am correct, it is in San Francisco. And this is an organization that specializes in the population that the question has come from. And so another thing that's important to note is the United States government, particularly in the Office on Violence Against Women, absolutely recognizes the need for culturally specific and culturally sensitive services. Someone has ever so cleverly put up the Asian and Pacific Islander Institute up on the website. And so that would be one thing. And our office even has a specific grant program that's brand new, and it's the Culturally and Linguistically Specific Services Program, because we do recognize the need to tailor services to specific communities.
Thank you, Cindy.
Thank you for the question.
I have a question here for Rachel. And Rachel, I apologize. You keep going back and forth between Rachel and Dr. Jewkes.
Rachel is
answer to both.
Yes.
One of our audience members said that she recently learned in a documentary on sexual assault in South Africa that 1 in 2 women are raped, and she wanted to know if that figure is accurate.
No, I think that a figure of 1 in 2 women being raped is probably a little bit high. We do have a very high prevalence of rape, and the research I did with women in the community who were aged 18 to 49 showed that 2% of women were raped or experienced rape or attempted rape per annum, which is very high. In general, in our studies, we have shown if we include all forms of rape, the types that more commonly get reported to police, as well as intimate partner rape, which very often doesn't get reported to the police, we would be talking about something between 1 in 4 and 1 in 5 women having experienced rape. I haven't seen a prevalence that's higher than that. And that sort of figure is also very much in the ballpark of the prevalences we have for men reporting having perpetrated rape. So it's a huge problem. These sorts of prevalences are actually extremely high, and we do think that rape in South Africa is probably tends to be more violent than rape in other countries. We have a very, very high prevalence of gang rape, but I would say that 1 in 2 was probably higher than we have been shown.
Okay, thank you. Gary, a question has come up about the use of DNA in rape trials in Colombia. Do you know how often DNA is introduced in the rape trials?
If you allow me to give a little bit of an explanation as to how trials are conducted here in Colombia, that'll provide a little background. Prior to the year 2005, prior to January 1st of 2005, Colombia did not have a oral trial or an accusatory system of justice in place. They had a judicial system that was based on a lot of paper and police reports and motions made by both the prosecution and the defense, and finally decided upon by a judge. In January 1st of 2005, and then in 4 phases throughout the country, Colombia enacted a new criminal code, a totally new criminal code that was based on orality at trial and the introduction of evidence at trial. So that benchmarked a new point in the use of any kind of physical evidence at trial. Not only CODIS or DNA-based biological evidence from crime scenes. Having said all that, I can say that I don't have a true number, but it's underutilized. It's an underutilized fact of most trials, and its root cause is there's not that much evidence collected at the crime scene. That was the purpose of the modifications to the police protocols, requiring a rapid response. A more rapid response to the victim, a more rapid response to the crime scenes, getting the victims to a clinical examination on a timely basis. And with those couple changes in the protocols, we're beginning to develop more samples and more evidence exhibits that require DNA analysis. We've got 2 or 3 programs in place trying to shake loose that backlog, and they're just starting to show some effects now by getting more and more analyzed samples into the CODIS database. But we're not there yet in that area. We've got a lot of work to do. It's recognized as a very valuable tool but only now are we beginning to get to the crime scenes and get the victims to the clinical examinations that they need to be at on a timely basis to develop that kind of evidence at all.
At this point, I'd like to bring everyone's attention to a website that is funded through the President's DNA Initiative here in the States, and it is called it's called DNA.gov, and you can see the URL there at the top. And through the DNA.gov, you can participate in free trainings on DNA, whether it's collection of evidence. It can be really a variety of issues, and there is just a lot of information on this website. So if there are folks in the audience, and it can really pertain to anyone from anywhere in the world, I would encourage you to visit this website for very cost-effective ways of training your law enforcement, prosecutors, advocates on DNA issues, from the very basic to some of the more complex issues. So I just wanted to raise that. I'd like to go back to one of our next questions here. And actually, Gary, this question came in for either you or I, but I think you're probably best able to answer this. And the question is, why is DOJ working with Colombia? And I think that gets back to a little bit of the mission of ISITAP, and perhaps you can explain that a little bit.
Yes, the Department of Justice ISITAP program has been in Colombia since the year 1991. Most recently, though, over the past, let's say, 6 or 7 years, it was given a very large boost in the arm in terms of economic resources through the broader U.S. government initiative known as Plan Colombia. That was a program that came online in around 2001 and 2002. It had a variety of different aspects to the program, everything from military action and military training and hardware to the Colombian Armed Forces, to more traditional programs in development and assistance. And under one of the highlighted programs, there was a need to address the issues of human rights and human rights violations, human rights investigations. That's where the Department of Justice came in at that point, and ISITAP is one of the primary training and technical assistance tools, specially designed to meet that need and to provide those kind of skills. ISITAP's in a lot of countries around the world, not only in Colombia, but Colombia is one of the programs that has the longest or the most longevity. The efforts in the area of human rights here, of course, is important to both the Colombian government and the U.S. government. Therefore, it's a program that's frequently looked at, frequently evaluated, and considered as one of the most important initiatives that we're doing here at any one time.
Terrific. Thank you, Gary. Rachel, there was a follow-up to your question, to a comment that you made when we were talking about the number of women that are raped in South Africa. And the questioner says, did I hear you say that 1 in 2 men report perpetrating rape in South Africa? Could you clarify that a bit?
Yes, it's not as high as that. It's between 1 in 4 and 1 in 5 men. That's still pretty high.
So basically what you're saying is that women and men are reporting similar frequency?
Yeah, they are.
Of offending and both being victimized?
Yes.
Okay. This is a question that I am also very interested in, and that is, and this is for any of the panelists to address, but do you have specific programs or are there specific protocols in place to work with women who have been victims of sexual violence under war circumstances? Gary?
I can state, I can talk a little bit as to Colombia's posture in that regard. Although that's here we're talking about an internal conflict between rival terrorist groups, primarily the FARC and the paramilitary AUC members. You know, one of the things we discovered when we did our first diagnostic working group meetings that I mentioned back in 2005, when we looked at the overall picture and the status of sexual assault investigations and then the sexual assault after action victim assistance and victim treatments, we found that assistance to the victim in Colombia was way ahead of the investigation phase in this regard. In other words, we found that there are a lot of agencies in Colombia that are set up in place and are functioning pretty well in the area of victim assistance. The investigative side was the lacking component there, and that's why we, and being Department of Justice, that's more of our specialty. That's why we inserted ourselves in that area. However, yes, we do have instances of sexual assault that are related to the internal conflict within the country of Colombia, and in fact, there's a special investigative unit assigned to the National Prosecutor's Office that works those cases exclusively. Now, you can probably imagine those cases are probably some of the hardest to investigate because in reality, the reporting is very often very, very, very much after the fact. You consider a rural area or a small town, it might be almost under the control of one of these terrorist groups. There is no police presence, there's no government presence there. The crime takes place while the terrorist group is in control of that small town. One way or another, the government reasserts itself and is able to take over control of the town. Now, a good long time has went by, possibly years. The rape case is finally reported, and the only thing, unfortunately, that you're going to have is probably the testimony of the victim and possibly the testimony of a witness or somebody that the victim spoke to after the occurrence of the rape. So, very difficult case to investigate. Probably not going to be working that case with any physical evidence, any forensic evidence. It's going to be a testimony-based case. It's going to be a lot of time that will have lapsed from the event of the crime to the first reporting in any investigation. So you're working against very long odds and against against time and a lack of all the kinds of things all the kinds of evidence you might be able to develop in a more traditional urban setting investigation.
Okay, thank you. Rachel, did you have anything to add to that?
Well, just to say that the Sexual Violence Research Initiative has got a web page and has got a whole list of resources and contacts on the whole area of sexual violence and conflict, because it's obviously a very sort of important area, in Africa. And I have to add that actually, just going back to the honor killings question, we've also got a page on harmful traditional practices, and there are resources on honor killings, not South African based, but from other countries that are there. So that might be useful for the person who asked the question who wants to explore it further.
Okay. And Cindy, was there anything about rape during wartime that you took away from your meeting with the UN at the UN Security Council, or anything from your Crime Commission meeting at the UN?
There was not the issue of rape in conflict zones did not really come up during the Crime Commission meeting, but obviously it was discussed at the UN Security Council meeting, and that was in fact the main discussion, and apparently the first time that discussion had really been had. The one thing that I would mention from the United States point of view is our office, the Office of Violence Against Women, does not give grant money overseas, but we do give grant money to nonprofit agencies, NGOs that are serving rape victims here in the U.S. And so there are some places that have large immigrant communities that have specialized, focused outreach to those communities that may have come from a war zone. Additionally, we've had some discussion with the Department of Defense about making sure that returning veterans, veterans from Iraq, those returning veterans who have been victimized while they were in service are receiving the services and counseling as well.
Okay, terrific. We have a question here about rape kits and the use of rape kits in other countries. Number one, whether kits are used and how they might be different from those in the United States. And that may be a little bit difficult to answer, but I would like to hear what Gary and Rachel have to say about kind of some of the things that are included in their rape kits, if they have them.
The rape kits that we developed here are patterned after the rape kits issued in most jurisdictions within the United States.
Okay.
Colombia has. I just make one other comment. Colombia has the equivalent of a national medical examiner's office. They call it the Institute for Legal Medicine, and they have throughout the country specialized offices and areas in which sexual assault victims can go to either on their own to make a first report there or go there accompanied by a police detective. And there will be a doctor, nurse, or technician there to do a clinical examination on site. So we do have that. I think that's probably a situation. It's not unlike other countries, but we're trying to fold in the other medical community, the private medical community, hospitals and so forth, by teaching them what is evidence and what they need to do during the time when a rape victim should suddenly appear in their emergency room or in their hospital. So we don't do anything too different in that regard.
Okay. Rachel?
We do have rape kits in South Africa, and I'm not sure how I forget their history, so I forget whether they were modeled on kits from the US, but I suspect that they were. They've been used for over a decade for collecting a range of different swabs from victims, as well as, I think they're probably very similar to the sort of ones used in the US. That would be my guess. I think the key issue for us is that we've begun to get evidence on to really look at what happens to the kits after they're completed, and how often the kits are really analysed and taken to the point where we can get a DNA report to be available at the time that cases go to trial. And in fact, there is actually a massive problem in our system. And although we've had DNA analysis for over a decade as part of the investigation of rape cases, in fact, in research that was looking at what happened to cases reported to the police in 2003, we showed that a DNA report was only available in 2% of for 2% of the rapes, and actually it wasn't making any difference at all to the outcome of trials. And I think that this is very important, and we're trying to look at what's happening. But I think one of the conclusions is that actually in middle-income countries, very often I don't think South Africa is unique in this, that actually there are many problems in the operations of the police, and there are very many problems in terms of the way that the health sector operates. And actually the systems aren't, in some ways they're not joined up enough for something like the collection of specimens and turning that into some form of analysis that results in a report on DNA actually working properly. There are too many parts of the chain that are needed to be in place and working smoothly for that really to happen. And what we're seeing is that really DNA is not contributing towards outcomes in our rape cases. What does make a difference is having very well conducted examinations with good documentation of findings and those being presented well in court. And so this is really causing us to sit up and say, should we be placing as much emphasis on DNA and on the question of specimen collection, or should we rather be making sure that we have very well trained people who are conducting our examinations, who are doing a very thorough documentation of findings when they examine women and presenting that in courts in terms of contributing to the outcome. And I think the other side of that is us saying, do we really meet victims' health needs when we provide health care and meet their mental and physical health needs? And I think in the past there's definitely been a criticism that services have been overly directed towards the collection of medical legal evidence and insufficiently directed towards meeting mental and physical health needs of victims, and actually really making our services very much more responsive to victims' needs is sort of a key challenge for us.
If this is Cindy, and I wanted to just piggyback on something that Dr. Jewkes had mentioned. First of all, at the Crime Commission, when I brought up the concept of utilizing sexual assault response teams and having communities have a coordinated response to sexual assault, it was clear to me that most of the countries that were at this table were not utilizing sexual assault examinations as much as I think the Western Europe and Canada and the U.S. were. But I think it's important to mention from the perspective of a prosecutor, and this is so tied in with what Dr. Jewkes had said, that the reality is that DNA is helpful in determining who the victim was raped by. But what the reality is that, as we know, the majority of victims are raped by someone that they know. And included in that is the problem that most of the defendants are going to claim not that he did not rape her, but that it was consensual. And DNA evidence does not help you determine whether or not the rape was consensual. And in fact, I know that in most prosecutors' offices, both here and abroad, they will do the collection of the kit, but the DNA is not automatically sent to the lab because it's expensive. And a lot of times DNA evidence is kept until you determine, number one, is the prosecutor going to actually go to trial? Because if the guy is going to plead guilty, that DNA evidence, you probably are not going to spend the $2,000 to analyze it. And then even if it is going to go to trial, is the defendant going to claim, I did not do it, it wasn't me? Well, in that case, the DNA evidence is going to be analyzed. But if the defendant is going to claim, no, it was consensual because she's my wife, she's my girlfriend, I wanted her to be my girlfriend, she was my acquaintance, whatever, if that's the whole ball of wax, then there's no point in having the DNA evidence analyzed because that's not the issue. And I do think that in some respects there can be an over-reliance on DNA, and really sometimes the most important part of the forensic exam is not exclusively the collection of the DNA from that sperm, but rather the examination to determine, are there any bruises, are there any ligature marks, are there any defensive wounds, because those are things that can be used to contradict a defense of consent. And I wanted to also mention what Dr. Jewkes said. A lot of times the exam, it's important to get the DNA, but it's also important to, provide the mental health counseling and also physical assistance to give them drugs to treat any possibly contradicted STDs or to discuss emergency contraception. Sometimes those are the more important aspects of the forensic exam, and not just the collection of DNA evidence.
Cindy, this is Chris. I think that you made excellent points, and I would like to, at this point, kind of give a plug to our virtual practicum. OVW, the Office on Violence Against Women, and the National Institute of Justice kind of combined our resources to develop a virtual training tool that trains examiners, whether it's a nurse examiner or a physician or a physician assistant or anyone who has been who is conducting sexual assault forensic exams. It is a training tool to teach you how to do the collection and how to work with the patient. And it comes from both a forensic and a medical perspective. Rachel, you were talking about how in South Africa, some of the examiners, whether it was a physician or a nurse, were not kind of putting as much emphasis on the medical portion as they were on the forensic portion. And what this training tool does is it kind of balances those things out through learning how to do an examination through actually using a point-and-click mouse. You can conduct an examination yourself, and using several different scenarios of sexual assault. There are also different portions of the meetings where of the tool where a sexual assault response team discusses a particular case. There are interviews with survivors of sexual assault who talk about the things that were both good and bad about the examination. But the real point of this training tool is to show that you can perform a good, effective, efficient examination, and you can also help minimize the trauma to the victim at the same time. And this virtual practicum, you can purchase it through the website safeta.org, and you can see that at the kind of top of the little flyer we have here. And here is a screen capture of the SAFE-TA technical assistance website that is funded by the Office on Violence Against Women. So I just wanted to put a plug in there for those who are in our audience who may be looking to develop a SANE program or a SAFE program for their communities, or just want to learn more about the training aspects around sexual assault, forensic evidence collection. Okay, our next question. Actually, Cindy, staying with you for a moment. We have a member of our audience who is wondering if you could comment on prostitution and or sex trafficking and the prevalence of sexual assault within those crimes, especially among young girls, if you have anything you'd like to comment on there.
That is actually a topic that we at the Office on Violence Against Women have recently been spending a lot of time on, in large part because one of the issues that we are learning is that so many of the young women who find themselves stuck in the commercial sex industry are actually former victims of child sexual abuse. In large part, they were victims of child sexual abuse, and therefore they ran away from home. They were therefore gullible to domestic traffickers, to pimps who bring them into this industry. Because they were previously victimized, they had been, in some respects, groomed. Is an issue that we have really been taking a very hard look at, and especially as it pertains to the discussion of how when someone says the word trafficking, I think the most common thing that jumps into people's head is international trafficking, victims who are brought to the United States for labor or to work in the sex industry from other countries. And certainly those victims are victims of trafficking. But you can absolutely be a victim of trafficking even if you are from Toledo or Dallas or Los Angeles. And that is a group of women and girls that we have been looking at here. And we do know from our conversations with our friends in the UK and in France that they are absolutely seeing large numbers of women who are victimized by this crime. And I would like to know what Rachel and Gary are seeing in Colombia and South Africa as well.
If you'd like me to go first, I will. We have two different phenomenons in that regard here. One is sexual tourism, where travelers from other countries come to Colombia specifically for to participate in sexual tourism trade. And then we also have the incidences of sexual trafficking in persons from Colombia to other countries in the exterior. Colombia is classified as a source country in which organized groups, either by intimidation or trick, convince sometimes underage but oftentimes of age females to travel to other countries, and where they're practically held captive and hostage. So that's those are the two phenomenons that happen here in Colombia, that go on here in Colombia. Again, there's a specialized unit, a trafficking in persons unit at the National Prosecutor's Office that works in conjunction with a specialized police investigative corps, and their total focus is the investigation and prosecution of those two activities.
Rachel, did you want to comment as well?
Well, just to say that I think in South Africa, I think everywhere else, as far as I know in the world, there's a massive connection between prostitution and sexual violence, and people who are involved in sex work are very, very vulnerable to sexual violence. We do not have a major problem with trafficking in South Africa. We're glad to say it's one of the few things that we can be proud of not having a problem with. But obviously it is a very important issue, and again, I have to say we have links to many resources on the sexual violence website for people who are interested in trafficking, because obviously it is being increasingly recognised as a very important aspect of sexual violence.
Rachel, staying with you for just a moment, I'm getting a question referring back to our discussion about offenders and victims of sexual assault in South Africa. And the question is, can you describe the behaviors that offending men admit to when you are talking to them about rape and rape perpetration?
Well, if I take the question as really asking what is it we actually ask men that they do. In South Africa, we have done a lot of research to show that there is very little ambiguity around the question of the notion of sex. And so basically, if you ask somebody about sex, they have a very clear idea in their minds about the fact you were talking about penile penetration of the vagina. So it's not seen as an ambiguous question. So we don't ask in great detail about sort of specifying the anatomy of acts that take place, but we ask about having slept with a woman or girl when she didn't consent to sex or after having been forced. We always ask about having done this when she was too drunk to say whether she wanted it or not, and we ask specifically about whether these things have been done with girlfriends, wives, ex-girlfriends or wives. And then we always ask about having done it with other men, because gang rape is very common. And very often, because gang rape is seen as socially legitimate, a lot of men who engage in it don't actually see it as being rape. And so again, we ask very specifically about with other men forcing women into sex when they didn't consent, and so elicit it that way.
Okay, thank you. This question goes to Gary and Rachel, and Cindy, I have a feeling you'll want to say something about this as well. It says, what is being done in South Africa and Colombia to address the civil legal needs of sexual assault victims? Gary, for instance, are you familiar with this side of things?
No, I'm not sure what they're referring to in that regard.
The person that asked the question actually has a couple of examples, and one is employment remedies, housing remedies, privacy issues, etc.
So there's no specialized program for remedies that are such as the economic remedies that you mentioned. There are some shelter type agencies available to in which one can remove themselves from the situation and report to a family services type shelter. That is that's a social service that's available. But as far as then providing a rent payment, let's say for a house or an apartment to get back out on their own, that is not a program here.
Okay. Rachel, are you familiar with some of the work that's going on in regard to civil legal assistance for sexual assault victims?
Yes, I mean, I have to say, I think the short answer is that there isn't any. We do have laws guaranteeing the privacy of sexual assault victims in terms of media reporting, but we have no specific assistance with relation to employment or anything else. I mean, no, unfortunately, I mean it's a huge problem. People being raped and then being expected to go back home, and if they don't have the personal resources to, say, increase their safety, then they remain in a very vulnerable situation that may have contributed to them being selected as a rape victim in the first place, and obviously that's incredibly distressing for women.
Mm. Cindy, did you want to comment?
Thank you so much. I'm about to jump off my seat.
I can tell.
I am a passionate advocate for access to civil legal assistance for not only domestic violence victims, but also sexual assault victims, because I, as a prosecutor, saw all the civil legal needs that my victims had, but that I was not able to provide for them. And I sort of was making it just a quick list of the most common ones. Now, with a domestic violence, if your victim of sexual assault happens also to be the intimate partner or former intimate partner of the rapist, then the most pressing civil legal need that she is going to have is probably going to be custody of the children. One of the trends that we are seeing now is abusers attempting to force their victims to stay with them by threatening to and ultimately succeeding in obtaining custody of the children of the victim, and I've often said that victims of violence, female victims of violence, fear many things. They fear being thrown into poverty. They fear losing their job. They fear being able to find a job and supporting their children. But the thing that they fear most of all is losing their children. And so that's the perfect thing for the abuser to threaten them with. Victims of sexual assault, though, regardless of whether they are involved with or have ever been involved with the rapist, even if it's a stranger, they are frequently in need of a housing, a real estate type of attorney, because they do not want to go back to the apartment or the home that they're living in, and yet they cannot get out of their lease. And I had particularly a victim of sexual assault that all she wanted was to be moved to the third floor, and her apartment wouldn't do that because they didn't have any third floor available. And so she said, okay, well, I want out then. Well, they wouldn't let her break her lease. The other thing that they frequently need is many states will allow victims of sexual assault to get protective orders, which prevent the that rapist from contacting her in any way, which, if it is an acquaintance rape, is very, very common. Another one that they frequently need is assistance with employment. If they were raped on their way to work, on their way home from work, or while at work, they will frequently want to transfer to a different facility or no longer want to work there at all, and so they frequently need help with that. Another issue is confidentiality. That can be important, especially if there is going to be a criminal case. There are always attempts by defendants to have access to any advocacy files that may exist. Another one that we commonly see is assistance with immigration issues if the victim happens to be not a legal citizen. We actually have a legal aid to victims program here at the Office on Violence Against Women. It is specifically designed to provide for access to civil legal assistance, and specifically civil legal assistance that you can't get under any of our other grant programs because it can be used for divorce and custody and things like that. One agency, though, that we provide that provides civil legal assistance under our LAV grant is the Victims' Rights Law Center. It's located in the Boston area, and they specifically focus on providing civil legal assistance to sexual assault victims, not domestic violence victims, but specifically to sexual assault victims, and I have been very impressed with the work that they have done.
Well, it's obvious you don't care about this at all.
Not a lick.
Yeah. Thank you, Cindy. We did have a question about rape in prison, and one of our audience members is interested if there are programs in either Colombia or in South Africa to deal with, or any research studies being done on rape in prison.
Speaking for Colombia, we don't have a specific program designed in that matter. No, we don't.
Speaking for South Africa, it's a huge issue in South Africa, and I personally haven't done research on rape in prisons, but there are other organisations. The Centre for the Study of Violence and Reconciliation has done work on rape in prisons, and I think that it's an area that there's a growing awareness of. It's terribly difficult to deal with. There are services for prisoners who've been raped, but the risk of retaliatory violence after people reporting rape is very, very high. And we have the sort of problem of violence and sort of severe violence, including stabbings and murders and whatever in prisons, is really completely out of control in South Africa, and so people do take a very big risk by reporting rape, and so cases tend to come to the attention of the authorities really late. The one group where they may people may become aware of them earlier are people who get raped in holding cells who hadn't been convicted, but amongst convicted inmates, it really is quite risky reporting rape, and so it's very difficult to be able to provide people with the sort of health care needs that they, health care to meet their needs, and it's very difficult to be able to help people in that situation. So it's something that people are aware of as a very serious problem, but it doesn't have any very easy solutions because of the nature of South African prisons.
In the United States, as people may know, we have the Prison Rape Elimination Act, which Congress passed several years back. That actually created the Commission on the Elimination of Prison Rape, and there is ongoing work and ongoing study. I recently had the opportunity to meet with Margaret Chiara, who is running that operation right now, and they provide not only statistics, but are working on what the United States response to that should be. And I want to point out that any victim of rape, even if it is in an incarcerated setting, certainly qualifies as a victim of sexual assault and can receive funding for services for those victims can come from the Office on Violence Against Women.
That's great. I also am aware that the Commission has been working on developing a specialized protocol for responding to rape in prison, and I think they're using the national protocol that was developed here in the U.S. by the Justice Department as kind of a guide for that. I have a question here that, Cindy, I think is a good one for you. And the question is the U.S. government involved in the education and training of criminal justice professionals and their response to sexual assault?
Yes. Not only are we at the Office on Violence Against Women and also other government offices, Office on Victims of Crime, we are absolutely involved in training and providing technical assistance, but importantly, anyone who receives a grant from our office is required to attend and participate in technical assistance that is sponsored by our office, because we're interested in not only giving money out, but making sure that money that is giving out to local communities and organizations is being used to best help victims of sexual assault. And but in fact, before I came to the Office on Violence Against Women, back when I was a prosecutor in Dallas, I was in fact a grantee of the Office on Violence Against Women, and so much of my knowledge that I had the benefit to obtain was obtained through attending Office on Violence Against Women sponsored training and technical assistance. And so it is not only encouraged, but it is in fact required. And we work with some wonderful technical assistance providers to make sure that our grantees are really using money in a very victim-centered way.
Thank you. Got a couple more questions here. Gary, one of our audience members has stated that in Colombia, domestic violence has been very recently identified as a crime, and was wondering if any policies had changed in the case of intimate sexual assault, which I am interpreting to mean sexual assault between intimate partners, whether it's married or ex-spouse or boyfriend-girlfriend.
No, I don't know any. I don't know of any legislative changes that have occurred most recently. The problem is substantial. Of course, it's highly unreported. Again, when it is finally reported, it's the kind of crime that's a little more difficult to investigate. There's oftentimes testimony only. Not a lot of evidence. Probably has taken place over a long period of time, escalating to a point that finally causes the victim to come forward. It's tough. It's recognized as a significant problem and issue here, but the investigative side of it, the investigative work that's being done is difficult, and I would say the results have not been that positive.
Okay, thank you. I would, at this point, like to give another shameless promotion of a website, and that is NIJ's website, which we have recently revamped this website, but if you look on the left-hand side, the navigation tool there under topics, you can get in there and you can get all kinds of good information regarding research and resources. It actually summarizes the latest research on a number of different areas, and if you click on these topic areas, you would actually get into a more detailed list of areas. So I would like to encourage everyone to use the NIJ website when they are looking for specific information about a criminal justice topic. And it also has all of the contact information for people here working in NIJ, and we would love to hear from you with your questions or your comments. Going back, I actually have one last question that I think I'm going to ask for some very brief closing remarks from the panel. But the question that came in, and I'm not sure, well, we'll see what we get here, but was asking about how the terminology, the word rape, actually translates in different countries. I mean, is there a direct translation of the word rape in every country. What I noticed when Cindy and I were actually at the Crime Commission meeting together in Vienna, and we were talking about stalking, and we had to be very careful in recognizing the fact that stalking is not a word that translates very well in certain countries around the globe. So we kind of defined it as so that people would understand what we were talking about. And I'm just curious, do any of the panelists have a comment on how rape is translated in different countries around the world, or if there is a consistent translation? Rachel, do you have a comment?
Well, I was going to say, I'm not sure it's possible to have a consistent translation when you're talking about different languages. We have 11 official languages in South Africa, and so we always operate in a multilingual environment, and we don't have any difficulty translating the notion of rape, and I have never encountered it as a specific problem. I think that the whether how things get translated depends on the language you're translating into, because some languages inherently have a much smaller actual number of words in them than other languages, and so they tend to, instead of having an original unique word like rape, they might use a combination of words and say a phrase like forcing sex, and that may as much reflect the sort of limitations in the scope of the number of words within the language, as well as, I wouldn't say that it in any way would reflect a lack of familiarity with the notion of rape. So I think that rape, I think that the notion of rape translates very well into different languages globally. But the one thing that we always caution about is that the meaning of rape, when it is translated, may differ very much between settings, and in particular, there may be a range of circumstances in which sexually coercive acts are not regarded as rape. And I think, if you look at the legal systems, the most obvious example is the fact that there are still many countries in the world that don't recognize rape in marriage. And so we always caution people when they're thinking of doing research, for example, in different countries, and say, don't use the word rape in questions. Don't ask women if they've been raped. Don't ask men if they have raped. Ask if they forced somebody to have sex when they didn't want it, because that is an unambiguous description of circumstances. Well, in our setting, being forced to have sex is. It depends whether there is a great deal of ambiguity around the meaning of the word sex and whether you actually have to define it as penile penetration of the vagina or penetration with a penis or another part of the body. But and that will vary between settings. But in general, we would say to people, steer away from the word rape, because you run into the problem of many acts that would be regarded by people like us as being rape, acts of sex where there isn't consent, actually being regarded as not rape for various reasons in different settings.
Thank you. That's a very thoughtful answer. I appreciate that. At this point, we don't have a whole lot of time left, but I was just wondering if each of the panelists could give just some brief closing remarks for our audience here. And why don't we start out with you, Cindy?
Thank you, Chris. One thing I would like to highlight is that the Office on Violence Against Women is going to be administering a new grant program called the Sexual Assault Services Program. This money will be given to every state and territory, and it will go specifically for the purpose of enhancing rape crisis centers to make sure that victims are receiving the victim-centered care that they need. And while I think that we need to absolutely continue to focus on victims and make sure that they receive the care, both physical and mental, that they need, I really don't think that we can do this in a vacuum, because as long as we are raising boys, either through our social education or through our cultural education, that if we are raising them to believe that they can take control over women and that they can rape women and that they can prostitutes, and we are going to have the continuing problems that we do today. So while we need to remain focused on victims, we absolutely must focus on the boys that we are raising that are perpetrating these acts and make rape and trafficking still going on today.
Thank you so much. Gary.
Yeah, just one comment on Rachel's last words on the rape definition, and then I'll do a wrap up. But
yes, go ahead.
Here in Colombia, in addition to the requirement of what they call carnal access and accompanied by force, violence, or coercion of some kind, that law can also be applied to those who are either mentally or physically handicapped or disabled in a way that they're unable to resist. So they could be, although the word rape does not equate here either in a word-for-word translation, force or violence is not necessary to be charged with the highest level of all the sexual assault crimes that there are here in Colombia. But just going into a wrap-up, as I think I mentioned before, this is somewhat of a young program and a fledgling program for Colombia, but I see a lot of process and progress being changed and progress being made. Fortunately for us, I think we've got some good funding coming down the road. It's going to allow us to take what we've got so far and maybe take a few steps toward the future. Of course, our long-term goal here is to eliminate the instances of sexual assault and rape through competent and effective investigations and prosecutions, and improve the living conditions for everybody within the society here. So even though we're small and rather young in terms of years, I think we've got some future ahead of us.
Thank you so much, Gary. Rachel, would you like to make some closing remarks?
Yes, thank you very much. I want to say how very much I appreciated the remarks of Cindy, because I think that it's absolutely crucial that we put men in the picture when it comes to rape, and that we remember that the vast majority of cases of rape are perpetrated by men and boys against women and girls, as well as being perpetrated by men and boys against other men. And I think it's absolutely crucial that when we talk about sexual violence, that we don't only think about providing services for victims, but we do really think about how we can actually get down to the primary level and actually end the socialization of men into thinking that they're able to force women into sex when they feel able to do, and the desire to do so, and are able to do it. And I think it's absolutely critical that we develop and put in place interventions to change ideas around masculinity that provide men with a sense of entitlement, or some men with a sense of entitlement to being able to coerce women and girls into sex. So I think that's really critical. I just want to say that I think that it's really important that we carry on the very good work that's going on in terms of trying to develop responses to sexual violence, keeping it on the agenda. I think sexual violence is one of the most neglected areas of violence. It's one of the areas which is most difficult to get funds for, either for research or for developing victim services. And it's an area that in many countries in the world is still given very, very little recognition within the legal system, as well as within funding for responses within the criminal justice system and the health sector. And I think it's absolutely critical that we work to raise the profile of sexual violence and place it on the agenda very firmly as being a very important health and social problem. And that we use resources like the Sexual Violence Research Initiative to help us be able to strengthen the work that we're all doing and add value to the work that we're doing and share what we're doing with other people who are trying to provide services or undertake research, because we are such a small group of people who are interested in sexual violence and working hard on sexual violence internationally that really we can't afford not to collaborate and share as much as possible amongst ourselves, because it's only through working together that we're going to become strong enough to really raise the profile of this issue and put it on the agenda internationally. So I just want to say that one of our programs in the Sexual Violence Research Initiative is to try and strengthen the health sector responses through building policy, using research for advocacy, and through training practitioners in responses to meet victims' health needs. And anyone who is interested in that should really contact us at the Sexual Violence Research Initiative, because we want to be able to try and raise money and to strengthen the ability of people working in different countries of the world to be able to strengthen particularly the health sector response, but overall the criminal justice and health sector response to sexual violence. And we really hope that people join the SVRI, continue to be engaged with us, and come to our conference next year. So thanks very much.
Well, and thank you very much. It has been such a pleasure to moderate this panel with such a knowledgeable group of individuals here. So thank you very much, all of you, for participating. I want to thank everyone in the audience that participated today and listened. I hope you were able to take something from the discussion today. And at this point, I am going to turn it over to Jim, who is going to provide instructions on participating in the kind of after-chat reception.
Hi, thank you, Ms. Rose, and I'd also like to thank our moderator and our panel for a great discussion. You managed to get to dozens of questions, and that's just about the best measure of success we have for these events, and I thank you for that. I'd also like to thank Melissa Cohen at NIJ for her role in putting this panel together. And before I tell you how to get to the chat room that will be opening up, where you can continue this discussion with the other audience members, I just wanted to point out that we did pop up the National Institute of Justice website earlier, and I'd like to pull that up one more time, because posted there on the online expert chats page is an area right over here to the right where you can subscribe to receive updates about any new upcoming online events that we have about criminal justice in particular. There's also the Government Innovators Network, and if you register for that, you'll be informed of all of our online events, criminal justice or otherwise. But if you'd like to be informed specifically about criminal justice online events, come to the NIJ website and subscribe to be informed by email. And now I'm going to try and get you all to visit our chat room. Now there is a web link which I'm going to post in the question and answer tool right now. So all of you who can see the question and answer tool, you should see that I just posted a little line of text that says chat room reception link, and it gives a short URL address there. But I'm going to try something a little different than what we've done in the past when we did these chat rooms, which is open up a web window, which hopefully you can all use. So let's see if this works. So what I'm doing now is opening up a web browser window where the PowerPoint slide is right now. And this should be something that you can all navigate from this point forward. And right now you see there's a space where you can enter your name. So just type in whatever name you'd like to display in the chat room, and then click sign in. And I'll be there too as providing some technical support, but it's very easy to use. And you can type comments back and forth. You can type in URL addresses and they become hyperlinked. And you can share documents and resources. So it's a great professional networking opportunity. We encourage you to introduce yourselves to each other by your name, your profession, and what your interest in sexual violence issues are. And then maybe towards the end of the discussion when we're closing the room out, feel free to offer up your contact information to each other so you can stay in touch. And that's all I have. I'll turn it back to you, Chris.
I just wanted to once again thank everyone for participating and continue to keep up the good work. All of you are doing exceptional work, and I think Rachel's points were well taken in that we've got to continue to raise awareness around sexual violence and share information and fund good research and fund good programs and replicate those programs not only here in the U.S. but around the world. So once again, thank you so much, all of you, for your participation.